Neurocirugía de Educación y Desarrollo nace desde hace 5 años con un espíritu diferente a otro tipo de fundaciones. Nos dimos cuenta cuando realizamos nuestro primer viaje a África que uno de los grandes problemas a resolver era la hidrocefalia infantil. Hasta ahora este tipo de enfermedad era tratada con derivaciones y esto originaba grandes complicaciones y numerosos problemas a la hora de resolver este tipo de tratamiento.
The main challenge was how we can establish neurosurgical service in Zanzibar, because this service were not there, and we didn't have the specialists, we didn't have the equipment.
And I often get asked, and NED often gets asked, the need in Africa is HIV and diarrheal diseases and immunization and malnutrition and maternal and child health and pregnancies. Why choose neurological surgery to be the lead specialty? And it becomes very clear when you realize that through neurological surgery you are focused on a specialty that actually has an impact on all the areas we've just talked about.
When I am a neurosurgeon and we are providing this kind of service in our hospital, I am sure I'm improving other departments, not only neurosurgery, in a lot of items. For example, in laboratory, we should have a good laboratory for investigation, maybe pre-operative care for patients. Also, I will improve human resources because I'm sure we should send the nurses for training, for caring our patient after operation and during operation and post-operatively. If we improve this kind of service, later on we'll have a MRI and higher radiographic machines.
To put things in perspective as to the need for neurosurgical services, let's take the WHO recommendation. And the WHO recommends that there should be one neurosurgeon for a population of about 100,000. In Japan, for example, in some areas they have a neurosurgical presence of one neurosurgeon for 50,000 people. In the US, it's one neurosurgeon for 75,000 people. In Europe, it varies from about 150,000 to 200,000. If you look at the scenario all across Africa, we're looking at one neurosurgeon to about 6.5 million people. But if you look at sub-Saharan Africa, we have a neurosurgical ratio of one neurosurgeon for 10 million people. We're sitting in Zanzibar with two islands, Unguja and Pemba, and between the two islands we have a population of roughly about 1 million, and in its entire history, spanning over centuries, there are no neurosurgeons.
I wish one day to be the first neurosurgeon of Zanzibar.
Thank you very much for coming to our hospital.
We thank Ned very, very, very much. Million of thanks to Ned and the whole team who visit here in Zanzibar.
This is a very courageous work, and the children will really appreciate it a lot.
I would like to thank the NED Foundation for all they have done for us.